Hey guys, welcome to lecture number 6, which is pre-weaning calf management. We already talked about colostrum feeding and how to feed colostrum and milk, right? So we talked about tubing a calf. We talked about different routes of colostrum administration, right? Or milk, bottle feeding, bucket feeding, suckling the mother, and one of the techniques we talked about was tubing a calf, or insert via a calf feeder stomach tube. So I won't go into details on this YouTube video. You can watch this on YouTube. See that's the link, right? And this is about 10 minutes long, right? So I urge you to watch this. Okay, so he doesn't exactly follow the technical steps we talked about, right? But nevertheless, it's important for you to see this, right? Okay, and right, so let's skip that, right? This I will go through. Now we said bottle feeding is critical, especially at the beginning, right? And now what do you think? Do you think it's recommended to keep on feeding via bottle the whole 2 months or whatever during the pre-weaning period, or do you think we should shift to the bucket from the bottle? Right? So bottle feeding is fine, but the problem is bottle feeding is more cumbersome. Cleaning, disinfecting bottles would be more difficult, and in addition, you have to have labor, right? So labor not only for cleaning the bottles but also for feeding the calves. So whereas if you can if you can transition from bottle to bucket, right? Then that will be a lot easier. You don't have to have human labor to feed the calf, and also cleaning is also a lot more easier. Cleaning the bottle, cleaning the teeth, right? Mostly ideally you have to clean with hot water and soap, right? It's more difficult and labor intensive, right? And it's not necessary once the calf gets used to the bucket. Okay, so what do you think? Because we talked about um, uh, the disadvantages of bucket feeding, right? Which is, it doesn't the esophageal groove closure is not as efficient with the bucket compared to the bottle. So what happens then? What do you think? Uh, is it going to interfere with the esophageal groove closure? And in that case, is the bucket not recommended? What do you think? But you see, we don't transition the calves to the bottle right at the beginning. We can do the bottle for the first couple of weeks, and when we do the first couple of weeks, right, the calf starts this conditional reflex that we talked about, and then when it gets conditioned, the esophageal groove closure will take place when the calf observes the farmer preparing milk utensils, bottles, feeding other calves, etc., etc. And if you're on time, around that time the calf expects milk, right? So when esophageal groove closure takes place, is conditioned properly, you can use the bucket, because regardless of whether the calf drinks from the bucket or the bottle, esophageal groove closure will take place properly. Right? So typically, in large farms, they transition at around 10 days, 2 weeks, 3 weeks, depending on the farm, right? Okay, I hope that is clear. So let's watch this video. But before we watch the video, what do you think? Do you think it's an easy process? In let's say on the 14th day, instead of the bottle, you just put the milk into the bucket, and is the calf going to drink out of the bucket just like that? Let's watch this video and see. Yeah, so you may not get the sounds of this, so I urge you to watch this on this YouTube video. That's the link.
couple of Belgian blues that we've put in the pens. For some reason, both of these decided they didn't want to suck their mums, which is unusual. Makes it difficult for us because we've got to try and get them to drink milk from the bucket.
Right, you see? Now, the first calf, I don't know if you observed, the first calf had no problem. It kept on drinking, right? He just added the milk to the bucket. So I presume that's because it's an older calf. It looked a little larger, right? So it already knows how to drink from the bucket. But look at this calf. It just smelled the milk, right? It didn't drink. Why is that? See, drinking out of a bucket is not a natural physiological movement or process for a calf, whereas suckling the bottle is natural because suckling the bottle is almost as same as suckling the mother's teat, right? So that the vacuum action that's not unnatural, whereas this is unnatural, right? So you can't just add what milk to a bucket and blame the calf if it doesn't drink milk, right? So you have to teach the calf how to drink from a bucket. Okay, so I doubt a lot of people uh, do this in Sri Lanka. From the beginning, so watch the larger calf. He throws the water away, adds milk. See, okay, that one starts drinking milk immediately. Okay, but this
There
guy,
is a couple of Belgian blues that we've put in the pens. For some reason, both of these decided they didn't want to suck their mums, which is unusual. Makes it difficult for us because we've got to try and get them to drink milk from the bucket. The one on the left here, you can see there, it's actually learning how to drink from the bucket now. And it's not too bad. And this one on the right, I only put it in here yesterday. Doesn't actually really know how to drink from the bucket yet, so I've got to try and teach it. And the hardest bit with this one is getting the confidence of the calf to come to the bucket. Come here. So what I'll probably do, so you get them to suck on my fingers first of all. This is really the key to getting a calf trained from the bucket.
see, that's a natural movement for the calf. See?
He's sucking my fingers like replicating the seats. Come on, calf.
I hope you can hear this voice that I have to narrate.
Come on. Now, if I can put his head down in the bucket, I get a taste of the milk and my fingers at the same time. And what I'm doing then is I slowly withdraw. I've got two fingers in his mouth. Take one finger away. Right, taking that other finger away slowly. And he's not quite sure now, look. But he's going to look for the fingers now in the milk, I expect. Or he's looking for the fingers around me. So it's kind of a case of getting them used to drinking from the bucket and trying to get them out of sucking my fingers. Now eventually they'll get so hungry they'll actually go straight for the milk. See, I've got one finger in his mouth. A couple of times like that. Normally, now what he'll do is he'll mess around.
Okay, I hope you saw that, right? So that's the method to do it, but I want you to watch the whole video on YouTube. I'm not going to spend time on that here, right? So basically, you have to get the calf to suckle one or two of your fingers, right? So that will be a natural motion for the suckling motion for the calf. So it will suck on your fingers, right? Then you draw the calf towards the milk, right? And get while the calf suckles your fingers, the milk will automatically go into the mouth, and then the calf will learn to eventually drink from the bucket, right? It will learn that motion with the tongue, right? So that is how you do it, right? So it's not easy at the beginning, right? But once you train the calf, then it's easy. It'll just drink off the bucket, right? Okay. So now, what do you do if the mother has poor quality colostrum, or it doesn't have any colostrum, right? Now, certain examples might be the mother died during parturition, right? or the mother had a preterm calf, right? So let's say the calf was supposed to come out at 280 days, but the calf came out at 260 days of gestation, and then the mother may not have colostrum yet, right? Because there was 20 more days to go. Might have a little bit, but not sufficient. Then what do you do? So then what we can do is we can give something called a colostrum replacer, right? So this says first milk calf colostrum powder, right? So in let's say in Sri Lanka, let's say you're a farm manager, the Ambavilla farm, right? There is no colostrum. Calf doesn't have colostrum for some reason. What do? You don't have this commercial preparation either. Can you make colostrum? Right? You can, right? You can make colostrum, something like 3 cups of milk, one beaten egg, some kind of oil to get some fat, sugar to get the energy, right? Egg for the protein, and so on. But this lacks something. What does it lack? It lacks immunoglobulins, right? So remember, colostrum, we talked about this. Immunoglobulins, immunity is one of the major functions of feeding colostrum, not just the nutrition, right? So you can give the nutrition, you can give the hydration, but you cannot give the IgG by doing this, right? So that's why there are commercial preparations for that, right? We don't have that in Sri Lanka, but in the Western world there is colostrum to be artificial colostrum to be purchased, right? So you look at the ingredients here. Crude protein 50%, right? So what I want to show is this one. See, bovine serum globulin, so that's IgG globulin, right? Globulin protein 27% or 150 grams. Remember we talked about grams, right? So typically if you feed 100 grams, right, about 35 of that gets absorbed, right? 35 grams, right? So then if you feed within the first 2 hours, and for a calf having 3.5 liters of blood volume, uh, that gives 10 grams per liter or 10 milligrams per ml, right? Whereas this has 150 grams. So even for a larger calf, it will give more than 10 grams per liter in its blood, right? So this is artificial colostrum or colostrum replacer, right? So now this has just all immunoglobulins, right, from bovine serum globulin, whatever was present in the mother's blood, right? So typically you'll have to, where can you get this from? Bovine serum globulin, where can you get it from? You have to get from the blood of an adult, right? So you'll have to collect blood from slaughterhouses, right? So typically in slaughterhouses, you would have heard in public health and so on, that there's something called the blood meal, right? So they collect the blood and use it for, it's highly nutritious, right? Use it for feeding, preparing animal feed, right? So you can get the blood from there and separate it and take the globulin fraction out and use it for this kind of thing. So in addition to that, you can also get preparations specifically with I'm sorry, type of immunoglobulins you want, like E. coli antibody, right, or coronavirus antibody, right? So you don't do that routinely. If you know your farm has a E. coli problem or a coronaviral diarrhea problem, right, then you get this. So this won't be necessarily a replacer, but it will most likely be a supplement. So think about the difference between supplement versus replacer, right? So you need to understand, supplement and replacer are two different things, right? As per the meaning, English meaning, replacer is, you give it, you replace maternal colostrum altogether, right? Say, that you couldn't get any colostrum at all, right? Whereas supplement, to replace or supplement colostrum, right? So for example, look at the difference of the number of grams, 115 here and half that amount here, right? So why would you want to give a supplement rather than a replacer? Hmm? Say, for example, it was poor quality colostrum, right? Here it was lack of colostrum. Here it was poor quality colostrum. Calf drank, you couldn't make the calf drink all 3 liters, 3 or 4 liters. Instead, it only drank 1 liter, and you were not happy with the amount of immunoglobulins that the calf would have taken up. Right? So therefore, you decide to give supplement, right? Or else you have in a farm there are problems, like let's say there's so much joint ill, navel ill, diarrhea, pneumonia, you have all those, so you decide to give a supplement even if the calf drank all 3 liters of colostrum, right? So those are the examples where you will use supplement, right? Instead of replacer, right? So right now in Sri Lanka, there is no supplement or replacer, colostrum replacer locally available or locally produced. So if anybody is interested in producing something like this, you have a great potential, right? And this is something actually you can even do as a project, as a student project, as a master's project or undergraduate project, right? And produce a commercially viable supplement, right? So it's doable. A lot of potential in Sri Lanka. Okay, so like there are colostrum replacers, there are also milk replacers, right? So this particular sachet or packet I'm showing happens to be a medicated milk replacer, right? So it has, in addition to all the nutrients of milk, it also has oxytetracycline and neomycin sulfate, right, which are antibiotics. So they say they based on the calf weight, these in pounds, not kilos. So 75 pounds is something like 35 kilos, right? Based on the weight, right? This is the amount of oxytetracycline or neomycin the calf has to have, right? So depending on the calf weight, you can mix it in the milk, right? Or feed, right? Right. So that was some prerequisite to what we talked about last week, right? So now let's take the proper lecture for today, right? I'm sorry, not prerequisites, some points that I missed to cover during last week, right? Lecture 5 completion. Okay, so right. So now with pre-weaning calf management, because milk feeding is just one aspect. Pre-weaning calf management. What are the main goals of pre-weaning calf management? Right. So obviously, nutrition is one goal, right? But why does the calf need the nutrition for? Right, for growth, right? So we talk about basically 3 goals of pre-weaning management, right? So the first is to produce a healthy calf, right? So we talked about all these colostrum, medicated milk replacers, hygienic environments, all that, to produce a healthy calf, right? And then there's no point of the calf being healthy if it's growth retarded or growth stunted calf, right? So we want a healthy calf, but at the same time also a well grown calf, right? And there is, so usually in Sri Lanka at least, when people talk about pre-weaning management, this is what they care about: producing a healthy and well grown calf. But there is a important third goal, which automatically happens if you do the management properly, but you can optimize it if you pay special attention to it. What is that? That is related to the rumen, right? So basically, as you know, cattle are ruminants. We call them ruminants because they have a different stomach compared to a monogastric animal, right? A rumen instead of a monogastric stomach. But calves act as monogastric animals because their rumen is not developed yet. The main functional component of the complex stomach of the calves is the abomasum, which is the equivalent of the monogastric stomach. Right, so one of our main goals should be to transition the monogastric calf into a ruminant, right? So those are the three major goals. If you don't achieve those three goals with poor management, you will obviously have the poor health and like diarrhea, pneumonia, naval joint ill, and then you will also have poor growth, right? So initially poor growth and poor feed conversion ratio, which eventually end up in poor reproductive parameters as well. So typically we say our goal is to get the first service done at 15 months. That can get pushed to 20 months or even beyond 2 years. Our goal is to get the first calf at 24 months. Right, with poor calf management practices, this can get pushed to 2.5 years or even further. Right, and then all of these will also affect the first lactation yield, lifetime milk yield, etc., etc., etc. Right, so that's why it's important to get um, proper management practices going on so that you can avoid these short term and long term adverse effects, right? Right. So you say you have to um, be aware, right? Now, these are in dairy farming situations. We are not talking about individual calf management, right? Although we see that a lot in Sri Lanka with the small and medium scale dairy farming. Your goal is usually to manage a herd, right? So when you have a herd, when you have 100 calves or when you have 500 calves, right, it's impossible to keep disease away completely. It's impossible to keep zero morbidity and mortality rates, right? So up to a certain extent, morbidity and mortality has to be tolerated, right? So you can have as much as 25% animals getting sick, right? And in a certain age category, that's kind of not expected, but that's kind of forgiven, tolerable. But if it goes beyond that, then it becomes unacceptable, right? So we talk about different morbidity and morbidity rates for diarrhea and pneumonia, right? For scovers is diarrhea, calf diarrhea, right? So within the first 2 months, right, to have 25% calves affected from diarrhea is not unusual, right? So up to 25, so not all of them will be sick at the same time, the 25%, but during the course from 1 day to 60 days, on and off, about 25% calves to get affected with diarrhea is tolerable, right? That happens. But if you have 40, 50, 60% animals getting diarrhea, then there is definitely a management problem, right? So even if you are getting 25% diarrhea, that still means something is wrong with the management. However, still not no reason to panic because they are not going to die, right? And then but after 2 months you shouldn't have more than 2% diarrhea, and from 2 months to I'm sorry, so from here up to 2 months here from 2 to 4 months, and from 4 to 6 months you shouldn't have more than 1% diarrhea, right? So the numbers here would be 25%, 2%, and 1%, right? So but the pattern is slightly different for pneumonia, right? So here within the first 2 months we said up to 25% diarrhea, but usually for pneumonia within the first 10-60 days or 2 months you don't expect to see more than 10%, right? So more than 10% would be a problem, right? So here the second to fourth months diarrhea dramatically drops from 25% to 2%, but here it increases from 10% to 15%, right? So why is that? What do you think the reason for, what do you think the reason for that is? Right, so it's actually to do with immunity again, right? So we'll talk about that on a different slide, but I talked about passive immunity and active immunity, right? So right around 2 months, or maybe sometimes some, it depends on the book you look at, right? Some books say around 8 weeks, some books say around 4 weeks, around 6 weeks, depending on different studies and different textbooks. But what's important to understand is at a certain point passive immunity drops. The passive immunity the calf gets from the colostrum, it's not going to last forever, right? That drops, and therefore the calf has to develop active immunity gradually. Unfortunately, there is a window between these two where the level of immunity is very poor, where it has neither active immunity nor passive immunity, right? So during that phase, the pneumonia increases. So that's what's shown here between 2 to 4 months. That's why it increases from 10% to 15%. Right? So during this period, there is neither, I mean, not zero, but passive immunity goes down. Active immunity is still going up, but hasn't come up to the immunity level, right? And then after 4 months, right, from 4 to 6 months, it should be less than 2%, right? So here it's 25 to 2 to 1, here 10, 15, 2%. Now those are the tolerable or acceptable numbers, but anything beyond that is unacceptable, right? So if you have okay, so this is about mortality, right? So that's next slide, right? um, So I think I showed this to you earlier also when we were doing colostrum feeding. You see here that mortality rates, see survival, so the reverse would be mortality. So that would be zero mortality, that would be 10% mortality, right? So this is directly related to the serum antibody levels in calves, right? So higher antibody levels, lower mortality. Lower colostrum levels, higher mortality or lower survival. Right, 8% mortality here, 4% mortality here. Right, so even with, so that's like I said earlier, you are not going to get zero mortality. There will be the odd calf that dies, sometimes not because of poor management practices, but just that the calf is not fit, survival of the fittest, right? So some kind of abnormality, doesn't have to be a huge birth defect, but could be physiologically not fit enough, right? Or it could be poor management. So regardless, right? So basically, the fundamentally you need to understand is we need to give more colostrum, more IgG, better survival, lower mortality. Right. So within the first 2 months, right, basically um, up to 5% mortality can be You ideally want it to be even less than 5%, preferably 1 or 2%, but it's not unusual to get up to 5% mortality, right? We have visited certain large farms in Sri Lanka where they have up to 15-20% mortality. These are good farms I'm talking about. Intensive or semi-intensive farms, upcountry farms, private farms, right? So that's something wrong somewhere, right? So 4 hours to 60 days of age, right? 2 months. And the next 2 months, 60 to 120 days, it should not be more than 2%. And from 4 to 6 months, it should not be more than 1%, right? So this would be highly dependent on the farm management, quality and quantity of colostrum, etc. Right? So two things I want to say. One is that the proper pronunciation of the word mortality. I hear even professors saying motility. Motility is what you see in sperms, right? Motility or motility, right? That's not this. This is mortality, death rate, right? Morbidity, sick rate, right? So this is death rate. So usually in dairy or any animal production system, dairy, poultry, goat, they are not pet animals, right? So usually if you see morbidity or mortality, that usually reflects poor management, right? So in animal production system, we usually say disease is a result of poor management, right? So if you have bad numbers here or bad numbers for diarrhea or pneumonia, you just don't think about antibiotics or stuff, right? You have to think about management failure and fixing those management failures, right? So don't forget that it's not pet animals, right? Right. So we talked about three main diseases of calves, right? The first one we talked about was navel ill, going on to become joint ill, and the two other major calf diseases are neonatal diarrhea, which is also called calf scours, and pneumonia, right? You don't have to memorize these different organisms that cause diarrhea during different periods of time, right? But the reason why you need to know this is to be able to administer the correct treatment, right? So let's say typically during 5 to 7 days, so you have either coronavirus rotavirus or cryptosporidium, which is a protozoa, right? So is there any point giving antibiotics? No, right? So if the diarrhea is after 5 days, no point giving bacterial treatment. Of course, here, if it's salmonella, then it's a different thing, right? So this is the reason you need to know. If it's first 3 days, then it's definitely bacterial, right? But let's say fourth day, unlikely to be a bacterial disease. Of course, you don't get exact definitions like this, right? But usually, like I said, this is not a single animal that we are talking about. We are talking about a herd of calves, right? 100 calves, 200 calves, and out of these 200 calves, if you always see diarrhea within the first 3 days, okay, this is most likely E. coli. You can do a fecal sample culture and see if you can get a pure culture of E. coli, right? Or you do, and then you know this is um, uh, E. coli diarrhea, right? But it's not that straightforward, right? Because anyway, there's going to be fecal diarrhea, fecal E. coli that are common cells in the gut, right? So therefore, you have to look for, specific types, pathogenic types, right? And all that, right? So this is very complicated, right? That's why we can't, specifically do all these culture and ABST, antibiotic sensitivity testing and all that. So that's why you have to sometimes just go by tentative treatment, tentative diagnosis based on the epidemiology, right? So which is here the age at which the calves get the diarrhea, right? Right. So this is why you need to know this. If it's at 3 weeks, no point giving antibiotics, right? 3 weeks, it's most likely one of these three protozoa, right? So anyway, you have to have an idea. So if at a viva or exam I ask you, okay, a calf, herd of calves is having diarrhea at 3 weeks, what are the most likely causes, and you say rotavirus and coronavirus, wrong answer, you don't get any marks, right? So you need to have a rough idea about when calves will get these different organisms. Right. So now so something important for you to understand is, right, now like I said earlier, it's not just a matter of antibiotics. When you treat, I've seen many veterinarians, not only in calves and dogs, right? So they just give the antibiotic. They disregard the whole syndrome where calf has had a lot of diarrhea and has lost a lot of water and therefore may be dehydrated, right? So in which case you might need to give electrolyte or fluid replacement. Now, if it's only a mild dehydration, IV fluids is not necessary, but if it's moderate to severe dehydration, IV fluids might be important, right? So this is why you need to know this. So we do something called the skin tent test, right? Skin tenting. You can look it up on the internet how you do it. Some of you may already know it, seen it done in dogs and puppies, right? So based on the skin tent duration, you can estimate the level of dehydration, and accordingly, you need to think of uh, oral fluid therapy, right, based on the level of dehydration. Okay, so that's why this is important, right? So a lot of people, like I said, they would only think about antimicrobials, right? No, but you need to replace fluid and or electrolyte as necessary, right? So PO is per os, oral route, IV intravenous, which all of you know, right? So this would be treatment, right? So there's no point giving treatment only, because like I said, usually disease indicates a poor management practice, right? So you have to go and correct the management practice, which might be colostrum feeding, right? Poor colostrum feeding, or which might be heat stress, cold stress, chilly wind, unhygienic housing, right? Poor manure management, etc., etc. So you have to not only treat the acute cases but also address the poor management practices and fix all of those to prevent recurrence in the future, right? Otherwise these will go on. I think I must have told you this example when I was doing joint till. So once a farm manager, from a university farm, not our farm, agriculture farm, came and told me, doctor, we have this recurrent problem of joint ill. We've been giving streptomycin, which worked wonderfully well in the past, but now they have become resistant to streptomycin. So please give me a different antibiotic, right? So is giving a different antibiotic the solution? No, it's not, right? So he admits that he has a recurrent problem of joint ill, which indicates that there is a poor management practice, right? Which might be poor colostrum feeding, which might be poor sanitation, which might be poor naval management, right? So you have to fix those. Of course you give antibiotics to treat the current case, but preventing this in the future is a major goal of the veterinarian and the farm management system. Okay, so don't forget any of these. And in large farms, if you really can't get rid of a certain problem, let's say you have recurrent E. coli diarrhea, you have recurrent corona rotavirus, you do everything possible, but for some reason you can't get rid of it, and then you might even consider vaccination of the dam or even the newborn. More than for these early ones, 5 to 7 days, vaccinating the newborn won't do any good, because typically it takes around 2 weeks for immunity to develop after vaccination. So vaccinating the dam and getting high levels of antibody in the colostrum might be a good strategy, or else you supplement antibodies and so on, right? Okay, right. So that's about diarrhea, and now we want to talk about pneumonia, right? So here again you see the pathogenic organisms. It could be viral related, it could be bacterial, it could be mycoplasma, right? And so on. But just because you have those organisms, you won't get pneumonia unless there are these all these management related failures to support that, right? So poor colostrum intake, poor housing, presence of older animals. Remember when I talked about placing the maybe I have not talked about that yet, but placing the calf housing away from the adult animals, because remember, young animals have almost zero immunity, right? So having old animals in the vicinity doesn't help, right? Because for them, something might be a common cell, but for because they've already developed immunity, but for young animals, they've never seen this bacterium. The moment it gets exposed to it, they become diseased, right? Overcrowding, poor feeding, poor nutritional status, all of these have to come together to cause pneumonia. Same thing for diarrhea also, right? Poor management plus the organisms. So the typical bacteria you expect in calf pneumonia is Pasteurella and Haemophilus. Viruses would be these, right? So this is that window of susceptibility that I talked to you about, right? So like I said, depending on the textbook you look at, depending on the study people have done in different parts of the world, some books would say this window is 4 to 6 weeks. Some books would say it's 6 to 8 weeks, and so on. So I don't know. That will depend on the region, the management practice, the breed of cattle, and so on and so forth. But what we do know is at some point, the calf is going to be immune compromised or immune suppressed during this susceptible period of vulnerability or susceptibility. So as a farm manager, you have to watch out for that. The moment you observe that period of vulnerability, you take extra precautions, right? So these where passive immunity goes down gradually, right? And active immunity doesn't come up like magic. So that's why I said, there's no point vaccinating the newborn calves for diseases that you're going to expect within the first, you know, 2 to 4 weeks of life, because it typically takes 2 to 4 weeks for immunity to develop, right? Right. Okay, so that's why I remember on the previous morbidity rates, I said pneumonia occurrence gets worse after 2 months. That's because of that. Okay, so why should we care about calf diseases? Like I said earlier, these are not pet animals. Not because you love the calf so much, I don't want to lose the calf. I love you so much, calf. I can't bear the loss of you. Huh? That's not the reason. That might be 5% of the reason, but in a dairy farming industry, that is not the major reason. The major reason is the economic loss, rupees and cents or USD or Australian dollars or British pounds or whatever, right? So that is the reason why you care about calf diseases on one aspect, right? So it's expensive to treat, and then and on the other hand, like I said, short-term losses and long-term losses adds up to this, right? So it adds up to this treatment costs, right? See, cost of treatment for a single affected animal might be this, right? But then retreatments are included, right? So there is loss of everything gets affected, right? So then eventually it ends up being an 80 million pound loss to the British dairy industry, right? So like I said earlier, these not only antimicrobials, right? So you have to control the predisposing factors like sanitation, colostrum feeding, so on, right? And then so okay, so we said 5%, 2%, 1% per mortality, but is it always a reality? But if you look at this, you'll see uh, depending on the breed for this study, right? Depending on the breed, they have different rates of mortality, or is actually stillbirth, up as much as 10% stillbirth alone, right? So you need to know what's early embryonic death, what's late embryonic death, what's abortion, what's stillbirth. Define those, the different causes for those, and so on, which I have asked in the questions section. I'm not going to talk about those. You have to do your own reference, right? So anyway, but the basic thing you need to understand here is that it will depend on the breed, it will depend on the management system, right, etc., etc. However, you need to bring it down to those figures that I talked about, no less than no more than 5%, 2%, 1%. That's mortality the after birth, right? But even stillbirth, right? So 10% is unacceptable, right? Now, I think I might have asked you this question in the past, but I'll ask you again. So this is actually the last slide of the day. So I want you to think of one thing before we conclude. Right now, of course, technology has developed, antibiotics have developed, management practices, detection, diagnostic techniques, right? All of these have improved significantly from, let's say, the 1980s to 2000, year 2000. Yet look at the rate of stillbirths. They have gone up and up, right, for all breeds, right? So Swedish Holstein, red as well as white, right? This has gone up, mostly in this, right? And then but in red and white as well, right? So how do you explain this? In spite of all the technology developments, like diagnostic techniques, breeding techniques, right, all that have gone up, yet this has become worse. How do you explain that? Think about that. We will talk about it in the class. Okay, guys, that's all for today. So next week we'll talk about, feeding of pre-weaned calves. Okay, so make sure you answer all the questions before coming to the live discussion. Good luck.